5-HT and yes, coming to the topic 5-hydroxytryptamine, it's also abbreviated as 5-HT or serotonin. And serotonin was the name given by the vasoconstrictor substances, especially in the serum, and when blood clotted, and entrimine is the smooth muscle contracting substance present in the enterochromaffin cells of gut mucosa. That's why the name came, especially the 5-hydroxytryptamine or serotonin. And in the early 90s, both were shown to be 5-hydroxytryptamine. Both are same. And about 90% of the body's content of 5-HT is localized in the intestines and rest in the platelets of the brain. That's the little history and also the location. It is also found in the wasp and scorpion sting. Whenever the wasp and scorpions bite, they are widely distributed in many of these invertebrates and many plants, especially banana, then pear, the pineapple, tomato, stinging nettle, and cowhage. These are all the plants which do have very high content of the 5-hydroxytryptamine. That you may, I mean to say that apart from the biological source, many other plant sources are also there which do contain lot of serotonin or serotonin precursors and physical and mental effects of the 5-hydroxytryptamine. So here the physical effects of serotonin deficiency. Whenever there is low serotonin level in the brain, then disrupted sleeping pattern means possible oversleeping. Sleeping pattern is oversleeping. Then whenever there is a deficiency of serotonin, then you may feel low appetite, craving of high sugar and fatty foods. That's a person with serotonin deficiency will crave for high sugar and fatty foods, and the bone density will be very low, and also the person who is having the deficiency of the serotonin will have lot of fatigue, means always he is not having any interest to do the work, and many times there is nausea, and sometimes there will be pain, joint or the limb or back. All these things are expected whenever there is a serotonin deficiency. So it's also known as the mood neurotransmitter, especially the 5-hydroxytryptamine. Yes, the persons who do have the deficiency of the serotonin will have the fatigue, drowsiness, and sleepiness. All these characters are the deficiency of the serotonin. Then the social effects of the serotonin, because of its reward processing and its lifts mood, and because of the close link to dopamine. The serotonin and dopamine each are related to each other. So low serotonin can feel us to have the high anxiety towards group exclusion. High anxiety towards group exclusion. That's the social behavior. And in this term can develop a social ladder, a competitiveness regarding friendship and reward. So this is the low serotonin. Uh, Whenever there is a low serotonin, such things will happen in the human beings. The impaired learning and imitation learning ability, then the stress and anxiety shown to impair frontal and parietal mirror neuron system. That's why there is impaired in learning, and the what you call as, you cannot remember. The persons who do have the low serotonin level will have always the drowsiness and will be a sleepy persons, and impaired social bonding means the father and mother and the brother and sister, all these social bondings, or in case of animals, the offsprings and the mother, all these bondings will be loosened. So serotonin genes are also linked to autism and Asperger's, so few of the diseases, and slow assessment of social interaction will be there whenever there is serotonin deficiency. So what we can say is it is a chemical of the mood. Yeah, the some of the foods are there which are very rich in case of, and a few of the habits which increase the quantity of the serotonin in the brain and make us to feel very happy. The banana, which boosts the serotonin, and these are all scientifically proved things. And if you find the time in nature, then it will increase the quantity of the serotonin. And the foods which are leafy greens, they will boost energy. Walnuts, omega-3 fatty acids, and smiling releases happy hormones. So the Epsom salt or the magnesium sulfate, oats, salt calming. Then there are many other pepper and water hydration, green smoothie, then almonds, walking in mind in boost serotonin levels. So apart from this one, many other papaya, then the many other as it is shown very represented here. It's a serotonin is the one which is rich in many of these, particularly the vegetables, then some of the greens, then some of the salads, etc. Of course, in case of fish and chicken, it's also there. Apart from this one, it's also present in very high quantity in case of all these vegetables. So, better to any person should have to take all these regularly, because they are all the precursors of the serotonin. Then here is a plant which is containing the very high quantity of the serotonin, which causes lot of irritation. It's known as the Mucuna pruriensis. It's also known as the cow hage. Cow hage. So this plant is containing, especially the ponds, do contain very high quantity of the serotonin, but nobody can eat it because it's highly irritating in nature, especially. And synthesis, storage, and destruction of the serotonin is need to be discussed, as we have discussed in autonomic pharmacology of the noradrenaline. We have discussed about all these things. Hence, the 5-HT is a beta amino ethyl 5-hydroxyindole. You will see the structure. It's a beta amino ethyl group and 5-hydroxyindole. So it is synthesized from the amino acid tryptophan and regarded and degraded primarily by monoamine oxidase and to a small extent by dehydrogenase enzyme. So these are the very simply what we are going to explain, and in future we are going to explain it in very detail. Yes, especially the serotonin pathways, especially they are all present in the raphe nuclei to the cortex into the cerebellum. That's what it say. This is the raphe nuclei, and this is the area in which very high quantity of the serotonin is present, especially in the brain of the human being. And this is called as the serotonin cycle, because the tryptophan, which is present in varieties of the foods, maybe the vegetarian, both as well as the non-vegetarian, especially vegetarian, egg, fish, the soya beans, cheese, and many seeds, poultry meats, milk. All these do contain the precursor tryptophan, and this is converted to 5-hydroxytryptophan. And this 5-hydroxytryptophan, its potential use as antidepressant agent under intervention. Can we use this 5-hydroxytryptophan as antidepressant agent? Because whenever there is deficiency of the 5-HT, the depression goes. Usually the depression will lead to the suicidal behavior, and the 5-hydroxytryptophan is converted to serotonin, and the serotonin or 5-hydroxytryptamine is having very wide impacts on the mood, cognition, sleep, and memory, and it is later converted to N-acetyl serotonin, and it is the potential use for age associated cognitive decline and depression. This would be useful. And another thing is the another metabolite of the same is melatonin. So the function of melatonin is the circadian rhythm is maintained, sleepwalk cycles are maintained, immune functions are maintained, and it also serves as the antioxidant property. So this is the diagrammatic representation how tryptophan is taken up from the food and converted to 5-hydroxytryptophan, then to serotonin, then it is degraded as N-acetyl serotonin and melatonin. Yeah. the serotonin release and uptake cycle is also very similar to that of the noradrenaline. Serotonin is produced in the raphe nuclei, then released through the vesicle fusion. As usual, the tryptophan is taken up from the surrounding fluids and it's converted to serotonin, and it is going to taken up from the into the vesicles, storage vesicles. Then the storage sites, it is stored in serotonin, in the serotonin vesicles. After that, it is going to have the exocytosis and the fusion. Yeah, then it is going to released. The released serotonin will act on the post synaptic receptor 5-HT type of the receptor, and the clearing up of this released serotonin will be by one of the thing is presynaptic neurons. It is uptaken by the presynaptic neurons and also by the glial cells, and also it is going to dissipate outside the synapses. So ultimately its action gets extinguished. So here you can see the serotonin is reloaded or broken down, either metabolized or it is taken up into the vesicles. So usually the receptor binding will will make the receptor to activate the further cascade of events. And here the chemistry, this is 5-hydroxytryptophan. Tryptamine is 3-beta amino ethyl, 3-beta amino ethyl, 5-hydroxy indole. This is a indole ring, and this is a amine moiety and a hydroxyl amino 5 in the beta amino group is present, amino ethyl group, and also it is having the amide group, NH2 group, hydroxy indole. So this is the chemical structure of the 5-hydroxytryptamine, and the tryptophan, as usual, it is converted to the 5-hydroxytryptophan in presence of the enzyme 5 this tryptophan hydroxylase enzyme. Then with the presence of the 5-hydroxytryptophan decarboxylase enzyme, it is converted to 5-hydroxytryptamine. This is the 5-hydroxytryptamine. Then the 5-hydroxytryptamine is acted by monoamine oxidase. Then it is converted to 5-hydroxyindole acetic acid, or it is abbreviated as 5-HIAA. And with the help of the same enzyme dehydrogenase is present, then it is converted to 5-hydroxytryptophan. So this is the structure of the 5-HT or serotonin. And here also you can see this is the same thing, L-tryptophan. This is the chemical structure. It is converted to 5-hydroxytryptophan by the tryptophan hydroxylase, or in short form what we can call as TPH enzyme. Then the 5-hydroxy L-tryptophan, here you can see the structure, chemical structure is converted to the 5-hydroxytryptamine. Amine means aromatic L-amino acid decarboxylase enzyme. It is converted to serotonin or 5-hydroxytryptamine. The same tryptophan is there, whereas the 5 position the hydroxylase will take place, and ultimately it is converted to serotonin. Then there is a close parallelism between catecholamines and 5-HT, because the system is very similar to that of the 5-HT and the adrenaline, noradrenaline, dopamine, etc. The decarboxylase is, especially 5-hydroxy decarboxylase, is a non-specific, acts on dopa as well as 5-hydroxytryptophan. It's a non-specific enzyme and produce dopamines and 5-hydroxytryptophan respectively. So like noradrenaline, 5-HT is actively uptaken by amine pump serotonin transporter, that's known as SCRT. So it is taken up from the nerve endings. Then it is a sodium dependent carrier which operates the membrane of the platelets. Therefore, 5-hydroxytryptamine does not circulate in free form in the plasma, and the serotonergic nerve endings, it's not in the free form. So it's always dependent on sodium dependent carrier, and this pump is inhibited by the selective serotonin reuptake inhibitors. These are a very important class of the drugs in the recent psychiatry, which are also known as the mood elevators, selective serotonin reuptake inhibitors. And very commonly, these drugs, SSRIs, are used to treat the depression in case of the human beings, and also the tricyclic antidepressants are used. And the platelets do not synthesize 5-HT but acquire by uptake during the passage through intestinal blood vessels, because 5-hydroxytryptamine, tryptophan, is taken up by the intestinal cells into the body. Then it is synthesized to 5-HT, whereas the again like catecholamines, 5-HT is stored within the storage vesicles and its uptake at the vesicular membrane by vascular monoamine transporter, and this is inhibited by reserpine once again, which causes depletion of catecholamines as well as 5-HT. So usually the reserpine is going to deplete the catecholamines as well as the serotonin. So it is going to depress the mood. The degrading enzyme monoamine oxidase is a common for both noradrenaline and also the serotonin. Whenever the noradrenaline is broken up to the other neurotransmitters like the guanylate acid, etc., it is also going to convert the 5-hydroxytryptamine to its metabolites. So the isoenzyme monoamine oxidase A preferentially metabolized 5-HT. There are varieties of the monoamine oxidase. So monoamine oxidase A preferentially metabolize 5-hydroxytryptamine, or else both this noradrenaline and the 5-HT are the specific targets of the MAO. And serotonergic receptors. So any neurotransmitter should act through the specific type of the receptors. So here the 5-hydroxytryptamine receptors are classified into musculotropic D type of the receptors and also the neurotropic M type of the receptors based on their blockade by dibenzylene or phenoxybenzamine and morphine. So according to this type of the blockade, they are classified. Whereas subsequently 5-hydroxytryptamine receptors were differentiated by their high or low affinity for the 3H, 5HT in radiological binding studies. And coming to the receptor subfamilies, there are 4 types of the 5-hydroxytryptamine receptors, like 5HT1, 2, 3 and 4 to 7. So there are varieties of the receptor comprising of 14 receptor subtypes, 4 families and subtypes are there. Totally 14 subfamilies are there, and as on date, the 14 receptor subtypes have been recognized, and all 5-HT receptors except the 5-HT3 are G protein coupled receptors and act through decreasing 5-HT1 or increasing the concentration of 5-HT4, 5-HT6 and 5-HT7, the cyclic AMP production, decreasing the cyclic AMP production. So many of them are inhibitory in nature through decreasing the production of cyclic AMP. And the common characteristic is they work by generating inositol triphosphate, diacylglycerol and 5-HT2 as second messengers. And the 5-HT3 is a ligand gated cation, that's the sodium potassium channel, which on activation elicits very fast depolarization, because the properties of each receptor is changing, and accordingly the binding with sodium and potassium channel is with 5-HT3 type of the receptors. And in 1957, Gadam and Vesali, they isolated two types of the receptors, the M receptors, 5-HT M receptors and 5-HT D receptor. M receptors are located on the parasympathetic nerve endings controlling release of acetylcholine, whereas the D receptors located on the smooth muscles. Earlier these were found and now it is very clearly noted that there are four varieties of the receptor, 5-HT1 to 5-HT4 type of the receptors families and 14 type of the receptor subfamilies. And current classification scheme, here you can see that in the 1994 these have been systematically classified and 7 subfamilies of the 5-HT receptors are there. 5-HT1, 2, 3, 4 and up to 7 are there, whereas the 5-HT1 is subclassified into 5-HT1 and 5-HT1B, 5-HT1D, whereas 5-HT2 type receptors are classified into 5-HT2A, 5-HT2B and 2C. This is the sub-classification according to the recent data is concerned. And here you can see that the type of the G proteins associated with each type of the receptor starting from 5-HT1 to 5-HT7. Most of the receptors are the G protein coupled receptors except 5-HT3 which is ligand gated sodium and potassium channel gated receptor, and the 5-HT1 is inhibitory in nature, whereas the all other receptor 5-HT2, 3, 4, 5, 6 and 7 are excitatory in nature. That means the tissue get excited when these receptors are being occupied by the 5-HT. Then the distribution of these receptors, especially the 5-HT1A, and it was found in 1987, it is distributed in blood vessels. The agonist is haloperidol and many others are there which are going to act as an agonist like the yohimbine and quetiapine, whereas the antagonists are 5-CT and 14-OH DPAT, which are their coded substances, very potent, and use of drugs that act on this receptor like the anxiolytics. Antagonists are used as anxiolytics, and many of the agonists are also there. Non-selective is the analgesic acting as analgesic, centrally acting analgesic, whereas the 5-HT1B is present on the blood vessels and especially in the central nervous system, and it's responsible for the migraines, whatever the things. And similarly many other receptors are located in different parts of the body and parts of the brain, and many other drugs starting from 5-HT1E to ending with 5-HT5A. So lot of the what you call as the agonists and antagonists are there, and they are going to have different actions like the migraines and anorectic agent and antiemetic agent and gastroprokinetic agent like testosterone, and many other agents are there which are the pharmacological targets. And the receptor is located at raphe nuclei of the brainstem, whereas the 5-HT1A, whereas the 5-HT1D and B are the substantia nigra and basal ganglia. The function of the 5-HT1A is neuronal inhibition and behavioral effects, especially the sleep, feeding, then the thermoregulation and anxiety. All these are mediated by 5-HT1A receptor, whereas 5-HTD, 1D and B are having the contraction and production of the CSF and also the neuronal excitation. All these are the function of the 5-HT1D and B receptors. And 5-HT2 type of the receptors are once again classified into 3 subtypes and sometimes 4 subtypes also. And these are going to couple with G protein, activate phospholipase C. This is a G protein, phospholipase C, function through IP3 or inositol triphosphate, then the diacylglycerol, that is the IP3 pathway, whereas 5-HT2A inhibits potassium channel, the 5-HT2A. Usually the receptor is bounded by the 5-hydroxytryptophan, tryptamine, and the elicits different type of the activities through 5-HT2 type of the receptors. And the 5-HT2A is present in the vascular and visceral smooth muscles and platelets and prefrontal cortex, whereas the 5-HT2B is present in gastric fundus, and it is responsible for the contraction of the stomach, whereas the choroid plexus, it is containing 5-HT2C type of the receptor, and hypothalamus is also do harbor 5-HT2C receptors. The functions of 5-HT2A is neuronal excitation, smooth muscle contraction, platelet aggregation, and vasoconstriction are the different actions of the serotonin through 5-hydroxytryptamine A type of the receptor, whereas the C type of the receptors, the function is production of CSF, feeding behavior, and mood, especially the mood elevating agents, especially acting through the 5-HT2C type of the receptors. And 5-HT3 receptors are inotropic receptors belonging to nicotinic acetylcholine superfamily of the receptor. There is a relation within 5-HT3 type of the receptor. Usually, the 5-HT3 receptors are present in the parasympathetic terminals in GI tract, including vagus and splanchnic afferents. So, whenever there is a vagal stimulation, there is the release of 5-HT3, and in case of central nervous system, solitary tract nucleus is the one in which this 5-HT3 type of the receptor, and also the area postrema. And the function of this type of the receptor, three type of the receptor, is emesis, then the neuronal excitation, behavioral effect, and anxiety. So here you can see that in the diagrammatic representation, 5-HT is going to act on 5-HT3 type of the receptor. Then in the synaptic cleft, the receptors are there which are going to have the postsynaptic membrane are present in the membrane, whereas 5-HT4 receptors couple to G protein and activate adenylyl cyclase, increase in the quantity of the cyclic AMP, and this is located in gastrointestinal tract and neurons of the myenteric plexus and on smooth muscle and secretory cells. And the CNS, it is present in the superior and inferior colliculi, then hippocampus region of the brain do contain the 5-HT4 receptors, and the function is evoke intestinal secretion and the peristaltic reflex. So apart from the what you call as the dopamine, then the adrenaline and noradrenaline, and also the acetylcholine, the enteric nervous system is also under the influence of 5-HT4 type of the receptor. So it's a very complicated one which is regulated by multiple type of the chemicals. And whereas these 5-HT5, 6 and 7 type of the receptors closely related to the 5-HT4 receptors, and they are mainly located in specific brain areas, but their functional role is not yet clear properly. Then the electrophysiological effect of 5-HT receptors, of course, the subtypes like 5-HT1A and B, there will be increased potassium conductance and hyperpolarization. So it is inhibitory type, whereas the 5-HT2A and 2C, they decrease potassium conductance and slow depolarization, whereas 5-HT3, the gating up of sodium and potassium will be taken place, and the fast depolarization, whereas the 5-HT4 it decreases, through which the potassium conductance and slow depolarization will take place. Then coming to the pharmacological action of the serotonin on different body parts. So the first one is the cardiovascular system, the blood pressure. There will be a early sharp fall due to coronary chemoreflex. It's also known as benzol gyrist reflex. Especially, there will be a sharp fall due to coronary chemoreflex, and this is known as the benzol gyrist reflex. Whereas the brief rise due to the vasoconstriction and increased cardiac output, followed by the prolonged fall due to the dilatation of the blood vessels, especially the peripheral blood vessels are dilated and the blood pressure falls down. With the initial sharp fall due to the coronary chemoreflex, and the brief rise will be present and followed by the fall. Here you can see that this is also the benzold gyrus reflex is noted as initial fall in the blood pressure. This is the normal stature, fall in the blood pressure, then it increases, then once again it is going to fall because of the activity of the 5-hydroxytryptamine. And the effect of effect on blood vessels and homeostasis or hemostasis. So whenever there is a vascular injury and there is initial platelet aggregation will be there, and because of this thing there is a release of 5-hydroxytryptamine which will act on the 5-HT1 like receptor and also the 5-HT2A receptor, and the accelerated platelet aggregation will take place and thrombus is formed and hemostasis occurs, whereas the vascular occlusion occurs because of the 5-HT2A receptors, whereas 5-HT1 like receptors, the endothelial release of nitric oxide, that's the endothelial derived relaxing factor, that's the NO, and ultimately the vasodilatation occurs, whereas the 5-HT2A receptors do the vasoconstriction. Ultimately, the homeostasis or the vascular occlusion occurs. And the heart, it is acting as the positive inotropic and positive chronotropic, means the it is acting to increase the heart rate and force of the contraction. Both are performed by the 5-hydroxytryptamine with the effect on the heart. And the visceral smooth muscles, the gastrointestinal tract, there will be increased peristalsis and increased secretion because of the subtype of the receptors which are present on the gastrointestinal tract. And the bronchi, usually it causes the bronchoconstriction, unlike the dopaminergic, this adrenergic system which causes the bronchodilation through beta 2 type of the receptors. And in varieties of the glands it is present, and important gland is the gastric secretory glands. At the acid, this hydrox gastric ketchial and pepsin are usually what happens, they are impaired, but there is increased mucus production and ulcer protective property will have this especially the pepsin and acid production will be decreased, but there will be increased mucus production, and hence it is ulcer protective property. The naturally the 5-hydroxytryptamine do have the ulcer protective property, whereas in case of the nerve endings, the activation of afferent nerve endings, because of this activation of the afferent nerve endings, tingling and pricking sensation and sometimes the pain will be elicited, and especially this occurs whenever they sting up of the arthropods. Many type of the arthropods, they are going to inject 5-HT and lot of pain and tingling and pricking sensation occurs. And on the respiratory tract, brief summation of the respiration and hyperventilation occurs, and large doses can cause transient apnea, very high doses. Especially, this is known as the coronary chemoreflex. And the action on the platelets, because 5-HT is also a neurotransmitter that's involved in the inflammation. So this is through 5-HT to A type of the receptor and causes changes in the shape of the platelets and is a weak aggregator of the platelets. And on the central nervous system, it is having a very important role, and direct injection in the brain causes sleepiness, the change in body temperature, then hunger and behavioral changes will be there if it is directly injected into the brain. Whereas the activity of the endogenous 5-HT is little bit different. The deficiency causes the depression, whereas the excess causes the excitation. And the pathophysiological role of this serotonin is it acts as a neurotransmitter involved in sleep and temperature regulation, thought, cognitive function, behavior, mood, appetite, vomiting, and pain perception. All these are the centrally mediated actions, especially the, and it also acts as the precursor of melatonin, pineal gland, and this regulates the biological clock and also maintain the circadian rhythm, means the day and night, the changes of the animal behavior in the day and night. In the night, the animal is going to sleep, whereas in the day it is active. This is known as the circadian rhythm. And the neuroendocrine function of this 5-HT is to regulate hypothalamic neurons that control the release of anterior pituitary hormones. What are all the anterior pituitary hormones? So there are many except oxytocin and vasopressin, which are the posterior pituitary hormone. All other hormones are anterior pituitary hormones like growth hormone, prolactin, especially TSH, thyroid stimulating hormone, and many releasing hormones are released from the anterior pituitary. And the nausea and the omission is also controlled by high hydroxy tryptophan receptors, and evoked by many cytotoxic drugs and radiotherapy, which are mediated by the release of 5-hydroxytryptamine. And yes, this migraine, especially felt by the human beings, its mediated initiates the vasoconstrictor phases of the migraine and participates in neurogenic inflammation of cranial blood vessels. So the one of the important indication of 5-HT3 or its analogs and antagonists, so the treatment of the migraine, and also the hemostasis. It causes platelet aggregation, the clot formation, that is the site of injury to blood vessel, and also promotes the retraction of injured vessels. So the healing process through the hemostasis is by formation of the clot and aggregation. And another disease known as the Raynaud's phenomena. Please remember the Raynaud's phenomena. It's a 5-HT3 release from the platelets may trigger acute vasospastic episodes of larger arteries. So in Raynaud's phenomenon, huge quantity of the 5-HT is released from platelets, and this is going to trigger acute vasospastic episodes of larger arteries. Hope you have understood this thing. The Raynaud's phenomenon is huge quantity of the 5-HT is released from the platelets, and it is going to act on the vasospastic activity of the arteries. And especially the act of this in case of gut. So varieties of the receptors are there, including 5-HT2A, 3, 4, and 1. all these receptors are present on the intestine or the gastrointestinal tract, and the intestinal smooth muscles, it causes contractions, and 5-HT3 fast depolarization of the enteric plexus and neurons and release of 5-HT from enterochromaffin cell, which is the highest content of, which do have the highest content of 5-HT type of the neurotransmitter. Whereas the 5-HT4, it lower the esophageal sphincter, then contraction, enteric plexus, then the acetylcholine release is there, and this occurs in the enhanced peristalsis, intestinal mucosa, and secretions. And slow depolarization is meant by 5-HT1 type of the receptors of the enteric plexus of the neurons. So it's also known as the gut neurotransmitter, and also many neurotransmitters do have direct or indirect effect on the gastrointestinal tract or gut, because the enterochromaffin cells do contain the huge quantity of the 5-hydroxytryptamine. And in case of hypertension, the responsiveness to 5-HT, and there is decreased uptake and clearance by the platelets in the hypertensive persons only. So the intestinal regularity, motility, etc. are regulated by the enterochromaffin cells, which do contain very high quantity of the 5-HT. And 5-HT containing neurons regulate the peristalsis of the intestine and local reflexes in the gut. Especially it is activated by intestinal distension. So especially in case of some persons who do have the irritable bowel syndrome, which is a syndrome, a multifaceted in nature. So irregular rhythms of the or spasticity of the intestine will be there, and usually such persons will have the depression, usually the person, or the vice versa. What we can say is that the persons in which who do have the depression, they will have the constipation due to the deficiency of the 5-hydroxytryptamine. And in case of carcinoid tumors, they produce massive amounts of the 5-hydroxytryptamine, leading to bowel hypermotility and bronchoconstriction. And there is a pellagra due to diversion of tryptophan for synthesizing the 5-hydroxytryptamine. There is the depletion of tryptophan for the synthesis of the 5-HT in the hydroxylase enzyme, in presence of hydroxylase enzyme. So this is a modulation of intestinal function by the serotonin, especially in the intestine. So all the types of the receptors are there: 5-HT4, 1A, 3, and 5-HT3 receptors are present in the different neurons of the intestine, especially the excitatory neurons are 5-HT3, and some of the 5-HT4 and 5-HT1A also there. So these are all the sensory neurons and bring the sense to the brain, and it is processed as the inhibitory motor neurons, like it is acted with acetylcholine and many other nitric oxide, vasointestinal act, this vascular acting intestinal polypeptide, and the ATP. They are all the second messengers, and there will be ascending reflex in the contraction. And also the 5-HT3, 5-HT4 receptors are involved in the different activities of the smooth muscles of intestine or gut. So usually there is a descending reflex, and ultimately the relaxation will be seen in higher doses. And this is the one chart one, where you can remember many things like what are all the agonists and antagonists to the different type of the 5-HT receptors, especially in case of gut, very specifically gut. And the agonists, this 5-HT1A are the buspirone, and the other drugs, especially on the 5-HT1B and D, is sumatriptan, rizatriptan, and naratriptan. Whereas the 5-HT4 agonist, 5-alpha-methyl 5-hydroxytryptamine itself, and 5-HT2B, the alpha-methyl 5-HT or the serotonin itself. Of course, it's also an agonist to 5-HT3 type of receptor, whereas the 5-HT4 receptors, the agonist is the testosterone, and of course the 7 and 5-hydroxy 7 do have varieties of the subfamilies, and it is the 5-HT1P is having hydroxylated endorphins as agonists. Whereas the antagonists are many, of course, few are coded and few are named. Like the uh, the example is the naratriptan and ketanserin hydrochloride is the and this agonist to antagonist to that of the 5-HT1B and 5-HT2A ketanserin, and the ondansetron is the 5-HT3 antagonist. It is also used as the anti-emetic agents in case of cancer-induced chemotherapy. Then many other drugs are also there which are having the proactivity as usual, and effects of this 5-HT1A through GI or GO, and GI or GO in case of the 5-HT1P, whereas the 5-HT2A, it's GQ type of the G proteins are involved. And usually it is G stimulatory in case of HT4 and HT7 receptors, whereas the distribution in the gut, it is present, especially the 5-HT1A is present in enteric neurons, and especially the 5-HT1B, 5-HT2A are present on the enteric nervous system and in the smooth muscles of the intestine. Of course, 5-HT2B is present in the longitudinal smooth muscle, whereas the functional response of the stimulation of different receptor is like that. There is first the action is, if it is acting on 5-HT1A, then there is decreased release of the 5-HT, whereas the gastric relaxation occurs through 5-HT1B or D type of the receptor. 5-HT2A contraction occurs, 5-HT2B contraction, and 5-HT3 EPSP excitatory post inactive potential and increased neurotransmitter released and secretion. And also the action of the drug on the trachea etc. are relaxation, and in 5-HT1TP type of the receptor, it is going to have the slow excitatory post-synaptic potential. And yes, this is also another what you call as the diagrammatic representation, in which the especially the gut mucosa do contain the receptors L, and it is responsible for the enteral motility to 5-HT4 type of the receptor, and the gastric emptying occurring due to the 5-HT4, 3 and 1B type of the receptors, whereas the fundic tone is controlled by 5-HT1B, 5-HT7, 5-HT1A and 1P. All these are acting. And the esophageal peristalsis is maintained by 5-HT4 receptor, and also the emesis is induced by the 5-HT receptor, and the 5-HT3 type of the receptor antagonists are the commonly used antiemetic drugs like ondansetron, granisetron, and many others. And 5-HT receptor agonists, coming to the first, especially the drugs to remember, which are all the different 5-HT receptor agonists and antagonists. Of course, in the next slides, 5-HT3 receptor agonists are classified as triptans, and here indole derivatives and selective 5-HT1D or 1B agonists. The examples of this category are the sumatriptan, elatriptan, favitriptan, naratriptan, zolmitriptan, razatriptan, and almotriptan are the recent agents which act on the 5-HT1D or B receptors. The mechanism of action on these receptors are mediated by constriction of dilated cranial vessels, especially on the anterior venous shunts in carotid artery. Whereas the dilatation of these shunt vessels during migraine attack is believed to divert the blood flow away from the brain parenchyma. That's why there is depletion of the 5-hydroxytryptamine and the patient will be depressed. So decrease means depress usually. And the indication of this treatment of 5-HT in case of acute attacks of moderate to severe migraine not responding to the any analgesics need to be treated by 5-HT receptor antagonists or the comparative features of the triptan. So they are the oral bioavailability is 15 minutes to meet triptan, and it is going to increase with the recently producing drugs like zolmitriptan with 40 minutes oral bioavailability, 40% oral bioavailability, whereas the Tmax is 1.5 to 2, and it's ranging in the 2 to 3 in case of naratriptan. And the T half or plasma half-life is it's 2 hours in case of sumatriptan, whereas it's highest in case of favitriptan or 26 hours, whereas in case of all other drugs like naratriptan and zolmitriptan, it is in the range of 1 to 6. The dose of these agents is from 50 to 500, especially sumatriptan, whereas the favitriptan, the dose is low, that's 2.5 milligrams. The maximum dose that can be administered to a patient is 200 milligram for sumatriptan and 7.5 milligram the for the favitriptan and rizatriptan 30 milligram per day, entire day, and 5 milligram it's the naratriptan recently introduced drug, and zolmitriptan it is 10 milligram per day. Total dose is 10 milligram per day. And the side effects of these serotonin directly, if it is given, it causes tightness in the head and chest, and paresthesia or tingling response in the limbs, and there is dizziness and weakness. Is hyperserotonic craze and the bradycardia, the coronary vasospasm, and there will be the risk of myocardial infarction. And the contraindications are the ischemic heart diseases, hypertension, and in the case of epilepsy. And the sumatriptan and ergotamine should not be administered within 24 hours of each other administered, because they are acting one and opposite in directions. So tomorrow we'll also discuss the individual agents, and we'll see how they are going to act as the time is leading.